brain attack is dangerous and the second brain attack is lethal. Hi, I am Dr. Biswajit here, practicing neurosurgery consultant from Apollo Multispeciality Hospital, Kolkata. Today I am going to speak about brain attack or the brain stroke. The brain stroke due to brain attack, or which is a special form of hemorrhage known as the subarachnoid hemorrhage, is manifested or it occurs in people with sudden severe headache. The patient complains that type of headache the patient has never experienced before. It is described as a thunderbolt headache. With this type of headache, the patient can sometimes unfortunately have loss of consciousness, become extremely obtunded when there is no option but to bring them to the hospital. Some patients, even after the headache, do not lose consciousness, but they complain of lot of sweating and profuse vomiting. Such patients with persisting hemorrhage or persisting symptoms to be brought to the hospital immediately, because with such a typical history of a sudden severe lifetime first headache, the patient's clinical diagnosis is a subarachnoid hemorrhage, which is a special form of brain hemorrhage, which is curable in maximum cases with timely intervention, but it also depends upon the extent of the hemorrhage and the presenting clinical status of the patients. This type of hemorrhage commonly occurs due to a balloon dilatation, which is a congenital problem, balloon dilatation of the blood vessels which rupture inside the brain. In our country, unfortunately, there has still not been any screening program. So most of the cases in India which come with subarachnoid hemorrhage are due to ruptured aneurysm or the brain aneurysm, which is a brain attack. And patients who come with a brain attack due to the subarachnoid hemorrhage, which is due to the aneurysm leading, should come to the nearest hospital with neurocare facilities, because they need to go urgently test like the CT scan and more sophisticated like tests like CT angio or a 4-vessel DSA, which will tell you the anatomical location or the position of the aneurysm in the brain. And this type of aneurysm, once detected, has to be treated either with present modern day microsurgical treatment, or nowadays people are avoiding surgery too, because we have an option of neuroendovascular intervention, where through coiling or stenting we can avoid a cut in the skull or going inside the brain, and we can put coil and successfully come out and occlude the aneurysm. Why does a brain aneurysm need a definitive treatment rather than a medical treatment until and unless a patient is obtunded or in a very poor clinical status? The reason is that if the patient has once a ruptured aneurysm and the patient has survival, without intervention the chances of second rupture is more high and the mortality rate is even higher. The patients who survive a first hemorrhage and deny treatment and go on to a second hemorrhage, the mortality rate is up to order of 80 to 90%. So patients who have a brain hemorrhage due to an aneurysmal brain or a brain attack, which is manifested as a sudden severe thunderbolt headache, should reach the hospital as early as possible, go the appropriate investigations as advised by the neurophysician or the neurosurgeon, specifically the neurosurgeon, and then go for the intervention depending upon the infrastructure available at the local hospital. With modern day treatment, although there is a complications like stroke, which is delayed but reversible in most of the cases, the life can be saved and the outcome is good. So presently there is a change in the concept of going for neuroendovascular treatment, because surgery has its own morbidity and its complications. So with endovascular treatment on one hand and microsurgical clipping, where we occlude the neck of the aneurysm or the balloon with a clip, the life is saved and the patient does not have a second hemorrhage. Although there are complications, but no patients would like to die of a second hemorrhage. And then subsequently, when our country develops a program of screening which is present in Japan, where patients with unruptured aneurysm are also detected with routine angiographic screening program, then the outcome will definitely be better. But as of now, patients who have sudden severe headache which has never they have experienced before the lap time should always go to a physician at least to rule out a subarachnoid hemorrhage, because having a subarachnoid can be very lethal. Thank you.